So I'll tell you a little bit about myself. So September last year, I heard of the ketogenic diet.
Okay.
And the reason I wanted to do it, I wanted to take the challenge, was not for weight loss purposes. I've always been quite small. But more so the mental benefits.
Okay.
So to feel the clarity and focus and the amazing benefits that come with training, endurance training in particular.
Okay. So you're an endurance person?
Yes.
Okay.
I'm running a marathon on Sunday actually.
Oh,
and it's the first long run. I've never run a marathon, but I've done halves.
Okay.
This is the first one I'll be doing off fat.
Okay, great.
Yeah, so at the time I was living overseas and I came back, had a blood test and tried to I wanted to chat to the doctor about the diet, except he knew nothing about it. Took the blood tests and that was it. Since then, I've been in contact with a couple of doctors at work and no one really knows much about it. And what I've realised is it's such a specialised thing, nutrition alone. Like I'm just not sure how much medical students actually learn at uni. So I tracked you down.
Okay, great.
So I've just got some questions. So would you mind me asking, what is your medical background? What made you want to specialise in this side of nutrition? Low carb.
I think a couple of things. One is that I've been working at this practice for the last 13 years, and this is a clinic that has specialised in chronic disease, particularly diabetes, fatty liver, what's called the metabolic syndrome, pre-diabetes, all of those things. So we have seen a lot, and for many years we haven't had much in terms of effective interventions. Sadly, one of the most effective things has been weight loss surgery for those people. But in terms of non-surgical interventions, we haven't had too much. And so I began to see people who were trialing low carb, and some of those people were doing amazingly. So it got me into the space of doing it. And then doing some research and finding, as I tried it with various people, that it was achieving amazing results. So primarily in the space of pre-diabetes, fatty liver, metabolic syndrome, those things.
So you work in the prevention as well? That is a huge part of...
A huge part of being a good doctor, I think, is preventing disease.
So as a nurse, I'm used to working with patients who have got the condition. They've got the illness, and it's just how do we treat it? And unfortunately, it's put down to drugs and medication. And I've just kind of now wanted to move towards the prevention side of things and spreading awareness. That's the YouTube channel. And I found when I first started the diet, I was kind of trying to do my own research. I was on YouTube, I was on social media, I was on all the websites, trying to find books and things like that, podcasts. However, on the YouTube front, I couldn't find anyone that I related to. So I was coming across a lot of people who had lost a lot of weight for all kinds of different reasons, rather than wanting to make it more of a lifestyle rather than a diet. And so that's where I kind of started. I'm like, right, well, there are more benefits to this diet and being low carb in ketosis. Not sure if you actually go as far as working with the ketogenic diet.
Absolutely.
You do?
Absolutely, yes, for a lot of people.
I'm so glad I found you.
And
so I guess that's where I started.
Okay, great. Fantastic.
So I guess you kind of covered this, but the kind of patients you would see, they would come to you with what kind of conditions and symptoms?
It's really interesting. There's been a widespread interest for a number of things. The two places where people primarily want to research keto or low carb are metabolic, so that is diabetes, obesity, and there's a lot more Australians obesity, but pre-diabetes and all the diseases that go with that, so high blood pressure, insulin resistance, fatty liver, all of that in one. The next group are the so-called neurological. So they're people who want the brain benefits of keto, and they're sometimes people with Parkinson's disease or a brain injury. Epilepsy is an area that's well established for the ketogenic diet. But some people want improved concentration, a more stable mood, because on a high carb Australian diet there's frequent sugar swings, and that can affect the mood as well. So I put it in two camps: the metabolic, which incorporates diabetes and obesity and all those related diseases, and neurological, which is primarily the brain.
Yeah. And so what about treatment? Do you have anything to do with the treatment and kind of research towards cancer?
So cancer's a really interesting area.
Yeah.
There's a friend of mine called Dawn Leman in Oregon in the US, and she uses keto as a supplement to therapies to enable them to work better. And that's a really exciting area because cancer cells are 20 times more hungry for glucose than normal cells. So if you starve out the glucose, you starve the cancer cells. The other thing is that most cancer cells are reliant on a chemical called insulin-like growth factor to drive the growth of the cancer. Again, with keto, you starve off that process and hopefully starve the cancer of fuel. So she uses it as an adjunct, which is an add-on treatment, and we're seeing some exciting things coming out of that.
It's just amazing where this diet can go years down the track. I guess it's just spreading the awareness and informing people that nutrition is so important in the prevention of so many different illnesses and conditions.
Yes, so there are obesity and diet-related cancers, and obviously if you're going low carb, you can help to prevent a number of those.
So if somebody were coming in with insulin resistance, what would their symptoms be? What would bring them here?
Well, it can be a whole range of things. Insulin resistance is a really broad, has broad effects. So I saw a lady today, a teenage lady, who had browning under her arms and her neck. That's a skin condition called acanthosis nigricans, and it's a sign of insulin resistance. And then when I tested her insulin levels, they were high, but insulin resistance can manifest as increased hairiness, increased facial hair on a woman. It can manifest as polycystic ovarian syndrome, so loss of a period, infertility, those sorts of things.
Interesting.
Obesity is the obvious one. And high blood pressure is mixed in with that, and obviously all the diseases that go with diabetes, insulin, etc.
But would you recommend this diet as a lifestyle diet, or would you kind of only put people in that direction who are at risk of developing these illnesses and conditions?
So,
like for me, young, healthy, fit. Would you, and I came to you and I'm like, I think I might try the keto diet, and this is like early days. Would you be like, great, go for it, or would you say, is it necessary?
So it's a good question. So not everyone has to do it, but it should be said that even the World Health Organization recommends that we dramatically reduce our sugar intake. So, for example, they're saying conservatively drop to 6 teaspoons a day of sugar. The average Aussie may be having about 27 teaspoons of sugar a day. So we're overloading ourselves with sugar. 2/3 of the Australian population are probably insulin resistant or heading that way, the adult population, and we're seeing it more in kids. 1/3 are very, very insulin sensitive and can probably overload themselves with carbs like the average Aussie. But we're heading in a bad direction. Fatty liver disease is going up, insulin resistance is going up, diabetes, even teenage and childhood obesity is going up.
Yeah.
Primarily sugar's at the root of a lot of that, and in particular sugary drinks. Yeah. So sugar's often thought of as the new tobacco.
Yeah.
So if someone's not in a space to drop their carbohydrates, I'll try and get them to drop their sugar.
Yeah.
And that even just doing that can have tremendous health benefits.
Yeah, sure.
Yeah. So I think most people would succumb to chronic sugar overload over time in their lives.
Yeah.
But there are some people who are incredibly resistant to it. I had a lady who could eat a whole cheesecake in one sitting, and she was as slim as a beanpole, and didn't have pre-diabetes, and she was 50. But those people are rare.
Yeah.
Wow.
Poor old fat's been slammed.
Yes.
Would you say the reason why you would go low carb before ketogenic diet for a patient is compliance? Like it's kind of black or white, isn't it? You're either in ketosis or you're not in ketosis.
Yeah. So there. I think when you're a doctor working in the community, you have to work where people are at. Some people are super motivated, and if I told them that they had infertility or insulin resistance or on their way to diabetes, they would go, right, tell me what I'll do and I'll implement it straight away. And for those people, if they're willing to go down to strict low carb, which is keto, I'll just tell them what to do and they'll just implement it and they'll do extremely well. They'll reverse their insulin resistance. Other people are not willing to make lifestyle changes. So I ask them, please drop your sugary drinks.
Yeah.
That's my first thing. If you can get the sugar out of the drinks and just have water, coffee, tea, stuff like that without any added sugar, that can make a tremendous difference in their life.
Baby steps.
Yeah. The next level would be dropping sugar, added sugar from the diet. And then the next level would be going lower carb, so trying to get rid of refined carbohydrates, starches, those things.
Yeah.
And then for people who are really interested in sort of dialing up the performance and everything, that's when full keto. So it depends where someone's at, and I try and assess that level. Yeah.
Somebody who is testing 0.5, so they're in ketosis.
Yeah.
Do you kind of see it as a bad thing if somebody's coming in and out of ketosis for a long period of time?
Cycling?
Yeah, I guess you could say.
Yeah, so some people do cycle. So, for example, there's one man who comes to see me. He has a pizza every Saturday night with his kids, and then sort of fasts early in the week, full ketosis for most of the week, and then Saturday night has a pizza again and bounces out of ketosis. But he's actually doing quite well. But he wasn't pre-diabetic to begin with. I think if someone's diabetic, pre-diabetic, they want to come off the insulin, they want to come off all the drugs, they want to fix their sleep apnea and all the bad things that are happening in their life, I would encourage them to go full keto for a while until their broken metabolism was fixed. And then if they need to, they could do some cycling. If someone has a sugar addiction, I would encourage them not to cycle, because if they have a whole packet of Tim Tams on a Saturday night, that could kick in the sugar addiction again.
There goes the binging.
That's right, there goes the binging, and they're out of a virtuous cycle. So it depends on the person, and it depends on their state before they came to keto.
I think what I found once I was adapted, I kind of, in the early initial stages, I'd be like, oh, can't wait to get to the point where I can actually have refeeds and cycle. But now I don't want to.
Yes.
I have nil desire. I don't
Yeah.
crave it. I had such a sweet tooth. I would be able to eat a whole packet of lollies in one sitting.
Yes.
And that would be nothing.
Yes. Yes.
And now I can't even, it's too sweet.
Yes.
I had a bit of chocolate a couple of weeks ago, and that was like the first time I was like, whatever. Because I feel like I'm in such control of the diet now.
Yes.
Like,
yes.
I can do that.
Yes.
I'm not cheating myself.
No.
I feel fine. I'm mentally stable in the diet. And it was too sweet.
Yes.
It was,
yes.
I couldn't deal with it. It was too much.
Yeah. Yeah.
So yeah, that was like a bit of a, I'm in a good place moment.
Do you know, I think that's one of the most important benefits of keto.
Yeah.
People feeling, particularly Aussies who have a high carb diet, feeling in control of their appetite again.
Yeah.
Not feeling a little bit stressed and needing to eat the Tim Tams. Just walking past the lolly counter at the grocer's or at the service station and going, I don't need that, you know, and having control. Most people in keto after about 6 to 9 months will eat about 2 meals a day. Yeah. And they won't snack in between because they're satisfied and they're happy. Yeah. And they're stable. They're not having sugar plummets, which makes you hungry and then hangry and all the rest of it. So, yeah. It's
amazing how much room you have in your mind to think about other things when you're not thinking about food.
Exactly.
I can be out and it's time for me to have my first meal. I usually intermittently fast, but not with the training that I'm doing at the moment.
Yeah.
And you know, you're in control. You can make informed decisions while you're out because you're not in a hurry. You're not desperate. You're not starving.
Exactly.
You're not, just eat that because it's all that's there kind of thing. So that's another
it's
amazing benefit.
People's mental space. They were formerly, oh no, if I go there or there, I won't be able to eat lunch or whatever, and I won't be able to handle that. But people on keto go, oh, if I go there and I miss a meal for a few hours, I'll be fine. And that's a very liberating space to be in as well. Yeah.
Okay, so with blood lipid profile, what should we be looking out for in starting a diet like this?
Yes. So first thing to say is some people who go keto will be what we call a hyper responder. Maybe 1 in 10 people, which means that their LDL cholesterol will go up. With that, sometimes you have to do what's called particle testing. So particle size and the LDL subfractions, which are the breakdown of the LDL particles. One of the most important markers is triglyceride levels. Yeah. And the other most important one is HDL levels. HDL having a protective effect, triglycerides being not just a marker of insulin resistance, but also of atherogenic or harmful particles. Okay. Yeah. So I focus on the triglyceride and HDL levels. Okay. Yeah, primarily. Yeah.
With cholesterol, what are the dangerous ranges? Like, what are the numbers?
Yes. So again, I'm very interested in triglycerides. So if you can get your triglycerides under 1.7, that's the cutoff. But a lot of people on keto can get it under 1.0. And if you're under 1.0, the chances are you have no dangerous lipid particles in your circulation.
Yeah. Okay.
Men and women are different with the HDL. Men have to be above 0.9, women have to be above 1.1. Okay. And again, with low carb, the HDL goes up and you get the healthier levels of those. Yeah. But I focus quite a lot on triglycerides. Okay. Yeah.
So my mum has high cholesterol.
Yeah.
My grandfather, her dad, high cholesterol.
Yeah.
And his mum, high cholesterol.
Yeah.
So obviously there's a bit of a pattern, and that is something that I am very mindful of.
Yeah.
What effect do you think this diet has on that? On the hereditary side of things.
Yeah, so the cholesterol, a lot of people get excited about cholesterol because it represents cardiovascular or stroke risk. So they're worried, ultimately, will I have a heart attack or will I have a stroke? And they're the big killers, so that's a reasonable concern. What we've discovered is that it's not as simple as just the cholesterol picture. So for example, no one's really looking at the total cholesterol number. I know everyone was running around saying, oh, my cholesterol's 5.5 and all of that a while back, but that's really old news. Now we look at the breakdown particles, the triglycerides, the HDL, the LDL. And the LDL was thought to be the bad guy for a long time, and there's been a lot of doubt cast on that now.
Yeah.
So there's a couple of things I do. One of the things is I get a normal cholesterol panel. I get an LDL breakdown, so good and bad LDL. And another thing is I go straight to a calcium score, which is to see if they have any disease in their arteries. So I saw a man who was 65 and had a calcium score of 0, which meant he had no discernible disease in his arteries. And someone wanted to put him on a cholesterol-lowering medication for the rest of his life.
Yeah. And
even though he was technically
that's my mum.
high, he has no disease. And if you've got no disease on a calcium score, you've got a 15-year warranty on your heart. So those people don't need to be condemned to a lifetime of cholesterol medication because they're clearly low risk, and that cholesterol number is not reflective of the bad particles in their system.
Yeah, so Mum came home and she's like, the doctor wants to put me on statins. And I said, no. You need to you need to do a bit of research yourself into this.
Yes.
Because I find that from what I've heard and just from communicating with like a few of my followers and things like that, they get a dangerous number, dangerous number. And then they're being told that they need to go on statins straight away. And I don't know, is it just there's just modern research now that not all doctors are aware of? I don't want to...
No, that's true. So the first thing I want to say is the space is changing. In the last 2 years, even in prestigious journals like the British Medical Journal and stuff like that, people are starting to question the absolute benefits of LDL cholesterol for lowering LDL cholesterol for everyone. So in particular, those over 65, and something called primary prevention, which is just a fancy way of saying preventing the first heart attack or stroke. There are clearly rarer people who have a family damaged cholesterol gene. And they can obviously benefit. But some people a few years back flippantly said, we should put statins in the drinking water, they're so wonderful. And now we realise that not only is that incorrect, but there's quite a limited range of use for statins. We're overusing them, we're over-medicating people. It really is the lazy way out for a lot of doctors.
I found when I would talk to people about this diet and they didn't even know what it was at all. They would relate it to the condition of ketoacidosis. And I still get funny looks whenever I go into a pharmacy and I ask for the keto sticks.
Sure.
Somebody who is testing repetitively and consistently above 16 millimoles, do you think that is...
So 16 is quite a high number.
Would you recommend everybody starting this diet to have an initial blood test?
So I do that as a baseline to work out where they're at. And that's really, really helpful because we can see if the person has insulin resistance, pre-diabetes, fully blown diabetes, poorly controlled diabetes, and that really determines the therapy. So if someone's already got fatty liver disease, poorly controlled diabetes, obesity, sleep apnea, high blood pressure, maybe have had their first heart attack.
Yeah.
Then if they're interested in keto, we'll have to go strict keto for a while.
Yeah.
So the whole talk about cheat days and back on the sugar one day a week and stuff like that, out the window if they're serious about getting well. Also, the people with cancer who come to see me, or neurological disease, they need high ketone levels.
Mm-hmm.
So they can't be low ketosis. They need to be high ketosis because they're trying to improve brain function, or they're trying to ward off cancer, and they've got to have minimal glucose in their system.
Yeah.
They've got to have higher ketones. So baseline blood tests give us a picture of where things are at. And they also tell me how healthy the person is and what I can recommend. So some people will say, oh, can I do this and this, or do I have to be so strict? And for some people who are doing fabulously well, I can say, well, you don't actually have to be too strict.
Yeah.
And we've got room to move. And I do blood tests down the track to see how they're going, and we can tweak the diet. Other people need to be incredibly strict.
Yeah.
If they want their health to improve. Yeah.
And so after the initial blood test, would you say, if the results are fine, like mine, come back in 6 months or a year's time, or
so it
just to monitor?
It depends on how healthy the person is.
Yeah.
If they're starting off spectacularly healthy and like you are interested in performance, both endurance and brain performance, then if the initial blood tests are fantastic, I'm happy for that person to come back in 6 months. Sometimes people are concerned about a family history of rising cholesterol, and they might be what we call those hyper responders. And we do need to have a talk. So some people I bring back in 2 months or 3 months if they've got a family history that warrants it, just so I can check cholesterol levels and see that they haven't gone through the roof. And even if they have, maybe finding out what type of cholesterol they have and whether they're at risk. So, but some people, yes, they can just have initial testing and then come back in 6 months or a year. And some people do that.
Okay.
Yeah.
A lot of, mostly women, ask me, did you experience hair loss?
Yeah.
Or amenorrhea?
Yeah.
So why are people, if they're not down to their goal weight, whatever that may be, why are they losing their period? Why are they losing their hair?
So some people I see...
How dangerous is that?
Some people I see have lost their periods because of polycystic ovarian syndrome. And I find often people on this diet will regain their period. So that's the first, and that's the majority. So the problem in Australia is not so much starvation or ketosis, but the opposite: overnutrition and loss of fertility. So that's the first thing. In the initial stages, there can be some hair changes that can happen in some people. And sometimes we test the thyroid levels and see what's happening there just to make sure that it's all okay.
Yeah.
That's not as common as one may think. 95% of people come back and say, I feel fantastic, my weight's going down, my period's returned, my skin's improving, all of those things.
Yeah.
But for the people who do experience that, it's almost overwhelmingly a transient thing with the hair changes. And I've never seen anyone whose hair hasn't grown back who's experienced that. Mind you, it's rare to have the hair changes.
Okay.
The other thing is, with loss of period, I think I would do some testing to see if the hormone that stimulates the period in a woman has dropped down in response to very low glucose levels. If the person is low calorie, this is important, low calorie, not low carb, the body could be in starvation mode and shut down menstruation. But starvation, which a lot of people with anorexia nervosa and sometimes female marathon athletes, sometimes that happens, and the women lose their period. But low carb is moderate protein and high healthy fat, and so calories are still coming in the body to fuel the system, and so that menstruation fertility cycle should not shut down if a woman is getting adequate calories. So energy. So some people try and combine low carb with low calorie and starve themselves and don't give themselves the fat and the moderate amount of protein in their desperation to lose weight. But that is a starvation diet and will probably induce fertility problems and loss of period.
Yeah. Okay. Yeah, I eat almost 3,000 calories a day.
Yep.
Because, well, I am training so much, but that's always what I've said to people. Just up your calories and see how you go.
That's right. So
I find you can just eliminate the risk of experiencing any of those like keto flu symptoms if your calorie goal is up. And then once you're in the adaptation phase, that's when you can kind of start playing around with your calorie goal and see. Exactly. So see how you feel.
It's a low carb diet. It's not a low carb, low protein, low fat diet, which is starvation, and no one can do that for a long period. No.
With endurance training, I'm playing around with it, but I haven't made the 42 kilometers. So do you work with athletes at all?
I do. Okay.
Tell me.
Okay. So the endurance is where low carb comes and the keto diet comes into its own, because you've probably noticed that marathon and ultra marathon and long distance cyclists hit a wall after a while. The Americans have this ridiculous term that it means something else here in Australia, but it's the term bonking, which means you hit the wall and you've run out of all your fuel stores, and unless someone gives you one of those
glucose gels,
you're curled up in a ball and you've got no energy left, and so if you're someone who's keto adapted, you've got this almost endless supply of energy, and you're not going to hit that wall. In fact, you'll be able to cruise on through it, because your body, the way it works is that you use up your glucose stores if you're a carbohydrate eater. Then you use up your stored glycogen, and that's when people hit the wall, because they've used up their readily accessible stores and their body is not ready to break down fat.
Doesn't know what to do.
And so some people literally shut down, curved up by the side of the road, on their bicycle, off their bicycle, and vomiting and in a terrible way. So that's one of the main benefits of keto, just being able to last and go the distance. Other things are loss of muscle cramping and muscle soreness after exercise.
Recovery time is just so much quicker.
And there are biochemical reasons for that. So injuries are lessened because of, again, biochemical processes and stuff like that. So there are plenty of advantages to keto for endurance athletes.
So it was a little ambitious, but I'm here. I made it. I decided to do this marathon a month ago.
Great.
After doing weight training for X amount of time. Like I hadn't been running long distance.
I've
always been reasonably okay at running. But I wasn't prepared. And so when I first started, I was like researching, and all these training programs are telling me to do 6-7 days a week, long runs, at least 10 kilometers. I did that for the first, and I was fine. No inflammation, nothing. I was watching these videos of, they've got their feet up with ice packs on day 7, and I'm just like, I'm not experiencing that.
Good for you.
Is there anything that you would suggest eating? So normally before a huge run, the 30 plus kilometer runs, I've found that what I would have is the night before I'd have salmon, so omegas, with like a generous side of like broccoli and spinach and something like that, and then like a good dose of olive oil and salt. And then in the morning,
salt's important.
In the morning I will have 2 scoops of nut butter. I found peanut butter was more effective, a handful of almonds, and a bulletproof coffee.
Great.
And I found that like got me through.
Fantastic.
Is there anything you would add to that, or?
So the only thing I would add is that you need to keep your fats up so you're fully keto adapted, because during the race you want your body to be naturally a fat burner and to access those fat stores, not go hunting for sugar. So don't kick yourself out of ketosis, keep the high fat levels up. Next thing is sodium's important. Low carb, your kidneys lose the sodium. High carb, you hold on to your sodium. Low carb, you let it go. You must replace the sodium or your performance will go down. Leafy green vegetables, which you mentioned, or dark green vegetables are really important because they're a source of magnesium. And some people will even magnesium supplement. Why is that important? Your muscles need magnesium to work. And if you don't have enough magnesium, you'll get cramps and muscle soreness and tiredness. So magnesium can be found in dark green vegetables, which is a favourite of keto people anyway. So those components are all important.
And to have a magnesium tablet before bed.
Great for sleep and great for the muscles.
With leafy greens, so in absorbing iron and getting the most out of the vitamins and nutrients, would you recommend cooking the leafy greens? Have you heard?
Some people are raw vegetable, love raw vegetables. We've overcome a lot of our problems with losing the nutrients out of vegetables because 20 or 30 years ago Aussies used to boil vegetables to death, and a lot of the nutrients would leach out or be destroyed in the cooking process. Now with steaming and people having a penchant for crispy vegetables, that's much less of a problem. But some people love raw vegetables, and more power to them. So but I don't think the yield is incredibly higher if you eat raw broccoli versus steamed broccoli. I think you're still getting a lot of good micronutrients.
Good. So I read something that a lot of people may experience bloating or digestive issues eating raw
cruciferous
vegetables.
It's
like broccoli and cauliflower and things like that.
So complicated question. Yes, that's a problem. Legumes tend to produce the most abdominal gas. And legumes tend to be higher carb, so most people on low carb find that their digestive system improves. In fact, that's one of the main benefits that a lot of people tell me. They come back and their irritable bowel is gone because they're not bloating and swelling and having lots of wind and all of that, largely because they've gotten rid of a lot of things that trigger that, including legumes.
So just one quick question. So when you're putting a patient on the ketogenic diet, would you tell them to kind of download an app, or how would you get them to track? Because tracking is so important.
Yes. So there's tracking, again, it comes to this high motivated, high efficacy individual, and then the person who wants it as simple as possible. So for the extremely motivated person, one great app is Australian Dietary Calorie Counter. It's an app on both the Google Android and iPhone. That can track your macro and micronutrients really well. So that's something I do. Other people, I just get them to follow basic rules. I tell people just get rid of the white things. Sugar, bread, pasta, rice, potatoes.
Just the obvious.
That's right. And then supplement the other things. I'm not so much concerned about people going overboard with protein unless they have really advanced kidney disease. And I think the person can go to town on healthy fats, olive oil, coconut oil, avocado. So the majority of people, I just give them some simple rules. But some people have a very targeted way of going about it and really want to drill down to and they'll keep apps and track it. And it's called Easy Diet Diary Australian Calorie Counter. You can do it with that.
Yeah, okay.
Yeah.
Because I use MyFitnessPal.
Okay, that's a good
really
one.
good. And then my sister's on Chronometer.
Yep. Okay. Both good
Chronometer's a little bit better because it does calculate the micronutrients and shows you the deficiencies.
Yes.
And works out the net carbs for you.
Yes.
So
yes.
MyFitnessPal's a bit annoying because you've got to do it. And some people struggle to understand how the concept of net carbs and incorporating the fibre into it.
Yep, sure.
But But
so there's different. Some people come in and they show me spreadsheets of what they've been eating, and they've tracked it down really, really well.
Yeah, wow.
Other people are going, oh, I'm still concerned about whether I can eat this and this and this. One great way to sort it out is get rid of the white things. Make sure you have dark green vegetables, salt, and consider having eggs, because if you're worried about all those micronutrients, the eggs, and particularly the egg yolk, is a really rich source of all those little micronutrients.
Yeah.
So I keep it simple for the great majority of people, and for those highly motivated people who turn up with spreadsheets, I look through the spreadsheets with them too. But yeah, there's different ways of going about it. Yeah.
Great.
Yeah.
Thank you so much.
A pleasure. Yeah.
You just taught me so much, and you will teach everyone I show this video to.
Good.
So guys, thank you so much for watching. I found Dr. Kristopherson at Church Street Medical Practice in NEWTOWN, Sydney. I just went online and typed in low carb, high fat diet doctors in New South Wales, and he popped up conveniently in my area. He is wonderful because he does specialize, so it is worth seeking out a doctor that specializes in nutrition and even better in the diet to actually give you the answers you need. I feel there isn't enough research and knowledge out there about the diet, so it's really difficult for your general GP to give you the answers that you need. Another thing with cholesterol, just be careful. If you're asked to go on statins, be mindful of what can actually be done before going on statins. Do your own research and maybe consider going and seeing a specialist. Dr. Kristopherson was wonderful because he agreed to let me film my appointment, and everything is perfect with me, which is nice and reassuring. Not that I doubt about it all, because I feel excellent. And he gave me a few tips on endurance running as well. But thank you so much for watching. I hope this was helpful. I've put the points in the description box with the time in which I asked the question, and Dr. Kristopherson has kindly answered the question. That way you don't have to sit through the whole vlog. But again, thanks so much for watching. I'll see you next time. Remember to like and subscribe.